Dr. Raywat Deonandan from the University of Ottawa, where he is an epidemiologist. Doctor, thank you so very much for joining us this afternoon. What does the Manitoba data tell you?
It tells me that you guys are deep into that mythical second wave, and it's looking pretty bad. I don't want to be too negative about this, but your test positivity rate of above 4%, that's usually a signal that some more serious public health endeavors need to be applied, like some better economic restrictions to prevent people from socializing more. Other jurisdictions use a cutoff of about 3%, maybe about 3.4%, to start closing things. So maybe it's time for your public health leaders to be considering some more actions.
We have closed some things, reopened some others. The politicians reckon that maybe this will come down in the days ahead as this starts to kick in. Usually, what's the length of time before we do see those cases reduce?
We keep saying 2 weeks, but that's not a magic number, and that's based on the number of days it takes to become infected and to show symptoms and to get tested and to get your test results back. So, yeah, about 7 to 10 days, 2 weeks on the outside. But there's no guarantee that these things will work. The plus side, though, is that we know what punctuates the spread of this disease now. It's super spreading environments. It's indoor environments with a lot of people gather. So restaurants and bars and nightclubs and possibly gyms and churches. So that's good news. It means we can target our restrictions accordingly.
We have seen it come down from the test positivity rate in and around that 6% mark. So we are starting to see it. We've been in level orange for probably close to 2 weeks now, and the bars have now closed, and we're told that will last for at least that one incubation period. So when you look further at the numbers, and this is something that Richard and I were exploring yesterday, the number of deaths involving seniors, about 40, and several of them concentrated within just a few care homes. Does the epidemiology show when there could be a potential issue at a certain site?
Well, yes, to the extent that once we see a signal at a particular site, especially one with a lot of vulnerable people, that's like dry tinder to a spark. A number of bad things can happen. But if we're seeing a signal in the community where long-term care centers are, that doesn't necessarily translate to an outbreak in that center if you have the right public health assets deployed at the front door, say. So it's a hard thing to answer. But if you're seeing outbreaks in long-term care centers, it means that something is broken, and we need to revisit exactly how we are attempting to protect these people.
We've heard time and again that the virus doesn't walk. It has to be brought in. Have we seen in most long-term care facilities across the country that most of the time it does start with a case in staff and then goes from there?
That was definitely the case in the first wave. It was employees who were working in multiple centers for a variety of reasons, and they're becoming infected and moving it around. So the employees themselves were the vectors. I would have hoped that now in most parts of the country we had put in economic disincentives for that kind of movement. So what might be happening is visitors are bringing it in. There might be longer incubation periods, so people are testing negative before they can actually, incubate the disease to a testable level and then being allowed in the facility. Or it could just be some sloppy practices. At some of the privatized long-term care centers, we have active disincentives for using PPE, for example, because they cost money. So we need to investigate exactly what are the procedures being followed in these centers and if they are, in fact, adhering to the best practices that we have advised.
Doctor, as you look at the data, are we getting all the information that we need to make sound evaluations? Certainly government's getting that data. I wonder, though, if citizens are.
I would say no. Now, in their defense, I don't think government is getting all the data either. In particular, contact tracing data is rare because so much of the contact tracing regime across the country is broken. We can't keep up with the number of cases. There aren't enough contact tracers, and citizens aren't being as cooperative as they could be in answering the questions that contact tracers pose. So there is a gap in data. There's also data that maybe a lot of citizens aren't privy to around surveillance information, like the wastewater analyses being done in some places like Ottawa, and that's not percolating all the way to the citizens. So it would be nice if raw data were made available to citizen scientists to do their own analyses. Why not? Let's make this a learning opportunity for everybody involved. But yes, transparency has to be a value that we embrace across the board.
We heard today from Canada's top doctor, Theresa Tam, that we need to realize that if you and I meet face to face, that it's not just you and me. We bring our bubbles with us. And I did a bit of a deeper dive on some of the numbers from the province today. And it shows recently that 2 people who tested positive, one had 58 contacts, the other had 53. And the province has been telling people, limit your contacts. What is the ideal? I know the fewest number possible, but what can they really hope when you look at these numbers, that people have less than a dozen?
There is no magic number, unfortunately. I think 10 is a number we go by because primates have 10 fingers. We can count to 10. But keep in mind, each one of your contacts has contacts, and one of them is going to be an extraordinarily social person. This is the nature of network analysis that we're discovering, is that this disease does not disperse evenly throughout the population. It explodes in small, punctuated, super spreading opportunities. And that's because certain people in the community have a lot more contacts than everybody else. So if that person is one of your 10, well, then now you have access to like 50 or 100 people, not just 10. So it's a difficult question to answer, but I'm going to give the answer you don't want, as small as you can make it. But again, if your contacts are themselves safe people, then you are a little less risk than if your contacts include a teenager who hangs out with other teenagers in the park every night. So it's a complicated question, and our best strategy is just keep to your family if you can. Do the best you can. We can tolerate some overstepping, but not a lot.
Raywat Deonandan from the University of Ottawa.